The World Health Organization has recently announced new clinical advice for patients affected by persistent coronavirus symptoms, also known as long COVID. Early Briones will give us the details live. Early, go ahead.
Good evening, Jago. After declaring COVID-19 as a public health emergency a year ago, the World Health Organization now issued new clinical advice for those who are suffering chronic symptoms of the disease, long after they were proclaimed to have recovered. WHO has found that a number of patients who were confirmed to have recovered continue to suffer from persistent symptoms of the disease, including extreme fatigue, persistent cough, exercise intolerance, and neurological and cardiac symptoms. The condition has since attained the nickname long COVID. However, decreased oxygen levels are identified to be one of the riskiest adverse effects of COVID, as it affects the respiratory system. Even for those who have recovered, it remains a critical factor of immediate deterioration if it persists, and it is not recognized early enough. WHO spokesperson Margaret Harris has then recommended the use of pulse oximetry at home for patients who do not yet require hospitalization. The small yet powerful device measures the oxygen levels in the blood and can alert the patient and their family whether they are deteriorating and in need of urgent hospitalization, significantly preventing critical conditions. The WHO also issued advice for those who remain in long-term treatment in the hospital. It was suggested by the organization that healthcare professionals, especially nurses, place patients on their stomach to increase oxygen flow for those using non-invasive supplemental oxygen. And last on the clinical advice guideline is the use of low-dose anticoagulants to prevent blood clots, recommended for more serious long-term cases. Harris stated that the guidelines are subject to changes every time new data becomes available.
As you know, we have expert groups in all areas of work involved with COVID-19, and we constantly search the literature, the research for new evidence.
The organization has also announced forthcoming plans to further investigate details surrounding the long COVID case to understand the condition as best as they can. Jago.
Thank you, Early Briones, reporting live from Australia.